Hello, everyone. My name is Dr. Elizabeth Kolawole, and I'm going to be talking to you today about integrative solutions to medical weight loss. So, I know you've heard of semaglutide and tirzepatide in the news and online and on TikTok and on YouTube, and everyone's using these things to lose weight. But I want to talk to you about integrative solutions to losing weight and things that need to be incorporated into your weight loss journey, ideas that need to be translated into your fitness journey and your losing weight journey, and all of these things. So, if you want to lose 5 pounds, if you want to lose 10 pounds, if you want to lose 20 pounds, take a peek at this video and hopefully it'll help you out. So, first, we're going to talk about causes of weight gain. Causes of weight gain. So we have things like genetics. So genetics is a big cause of weight gain. And look at your family tree. Look at your mother's side of the family. Look at your father's side of the family. And look if they're overweight or obese. If they are overweight or obese, these could be contributing to your weight gain. Your just simple genetics. There are things we can do about genetics. There are ways we could enhance our genes and have them work for us and not against us. But if your family is overweight or obese, it may be genetics, but it also might be dietary factors. So if your family is eating fast food, high carbohydrate diet, refined carbs, lots of pastas, lots of breads, lots of tortillas, and all these types of things, then it may not be genetics. It may be the fact that your whole entire family is eating the same exact foods, and that may be causing weight gain. So that's another thing to consider. Epigenetics. So epigenetics is looking at the different variations in your genes. So your genes are not static. They're actually very dynamic and they can change. So for example, two identical twins will have different fingerprints and they'll have completely different fingerprints. And this is they're true identical. Their DNA is the same, but their DNA has changed, called epigenetics, and this change in their DNA is changed on their fingerprints. So their DNA has been modified. DNA can get modified various ways. We see this also in diabetics. When a person becomes a diabetic, the high sugar content in their blood can modify their DNA. When you start putting sugar on top of your DNA and on top of your cells and your proteins and all things like that, that can cause things like heart attack, stroke, dialysis, amputations, and these are all the complications we see in diabetics. So looking at someone's epigenetics or the way your DNA has been modified can also help with your weight loss. There are studies that can be done to do this. There are, imaging studies for epigenetics. There are blood studies. There are hair studies. There are saliva studies. There are stool studies. There are urine studies that can tell you what DNA is changed and how this will help with your weight loss journey. So there are things you can do about your genes. The genes are not just things that you have to deal with for the rest of your life and there's nothing you can do to change them. Another thing is environmental toxins. So do you know that the average woman encounters over 150 environmental toxins a day before she leaves her house? These are things like hair products, makeup, lotions, bath products, right? These are things like perfumes, lipstick, mascara, things ladies like to put on them to smell very, very good, right? So all these toxins are not helping you lose weight. They're not helping you lose weight, and all these toxins are contributing to your weight gain. Your body doesn't know what to do with all these toxins that it comes to encounter with. And what it does, it stores it as fat. It stores all of these toxins in your body that it comes encounter with, that it doesn't know quite what to do with it, it stores it as fat. So we need ways to detox. We need ways to detox our bodies from all of these toxins. There are things you can take. There are supplements you can take. There are kind of diet guidelines that you can have to help you detox. So these are things that you need to discuss with your integrative medicine doctor about ways to detox your body, right? So if you're not detoxing correctly, it's going to be very hard to lose weight. Another thing, endocrine disruptors, things like dairy, things like soy, milk, ice cream, cheese. These are endocrine disruptors because they change the levels of estrogen and progesterone as well as testosterone in a woman's body, also a man's body. I'm not getting into that today, but men are ingesting things like milk and soy, and that's messing with their testosterone. When a woman ingests things like milk and soy, it messes with our estrogen and it messes with our progesterone levels, and these will make it harder to lose weight. Things like infertility, things like PCOS, all of these things can be contributed to endocrine disruptors or things we take into our body that disrupt our hormones. Our thyroid hormone is one of them. Our thyroid hormone is very sensitive. So things that we intake that disrupt our hormones or endocrine disruptors can jack up our thyroid really bad and make it very hard to lose weight. Also, hormone imbalance. So I know all my ladies out there who are menopausal and who are experiencing the hair on their chin, the abdominal weight gain, the difficulty sleeping, the hot flashes, the mood dysregularities. Maybe you're trying to figure out how to get a divorce, but you're not really angry at your husband. You're just menopausal, right? So these things, like menopause, will make it very hard to lose weight. So we got to learn how to manage menopause, right? We have to learn how to live with menopause, whether that's taking hormones to help our body adjust to menopause, whether that's taking estrogen, progesterone, or testosterone in leveled amounts, in concentrated amounts, to help our bodies understand and know that we're okay and that we're not dying, right? So these are things. Hormonal replacement therapy is the best thing you can do when you're experiencing hot flashes and abdominal weight gain and you're not feeling yourself and you're trying to lose weight. Hormonal therapy for a menopausal woman may be just the trick you need to lose those stubborn pounds that keep increasing and not going anywhere but your belly. So those are things to think about. Another thing to think about is emotional and mental health. Things like elections, things like job stress, things like grieving a loved one that you've lost to death, right? These things are traumatic, and these things can affect your weight. So when you're stressed out, your cortisol increases. When your cortisol increases, your stress hormone, which is cortisol, increases, and that can lead to abdominal weight gain, right? So when you're stressed out, that cortisol is like a sugar, and it's trying to calm your system down, self-soothe you're basically self-soothe yourself by increasing the amount of sugar. But those sugars, like cortisol, increase your actual blood sugar, but also lead to weight gain, because when you're increasing the sugar content in your body, you're storing it as fat. So stress and mental health does not need to be discounted in weight loss. If you're going through a lot of stress, it's going to be so much harder to lose weight. Now we're going to talk about the role of nutrition. Do you know that 77% of the foods in the grocery store are processed? Almost all the foods in the grocery store are processed. Do you know that 67% of the foods in the grocery store are ultra processed? That means that they've been changed up. There are certain additives that have been added to these foods, and these foods barely look like their natural state of food anymore because of the additives and things added to our food supply. So, processed foods affect your metabolism. I'll say that again. Processed foods affect your metabolism. Processed foods affect your metabolism. So when you're eating processed food like bagels, right? Even hamburgers, ultra processed foods, they're going to slow down your metabolism. They're going to slow down your metabolism, and they're also going to make it very, very difficult to lose weight. Potato chips is another example. So things like that in ultra plastic bags and bottles and things like that, things that are ultra processed are going to slow down your metabolism and make it very hard to lose weight. Carbs. Now let's talk about refined carbs. Are carbs a good thing? Are carbs a bad thing? So carbs, you need carbs, right? Your body is a macronutrient. Carbs, proteins, fats, part of the macronutrients. You need carbs. But the way we ingest carbs in the United States of America is out of control. And we are eating ultra refined or ultra processed carbohydrates. Cereals are ultra processed and ultra refined carbohydrates that lack nutritional value. They lack nutritional value. So when we're eating things like cereals and when we're eating things like our pasta with our garlic bread and our soda or our fine wine, things like that will make it very hard to lose weight. So carbs are not a bad thing, but we need to rein them back in. When I see patients in my clinic and I see patients who are skinny and they have low BMI, body mass index, and they have low muscle to fat content, but they're pre-diabetic or they're diabetic, it's because their carbohydrate intake is too high. So when I get skinny diabetics, type 2 diabetics, skinny type 2 diabetics, it's because their carbohydrate intake is too high. So we got to decrease that carbohydrate intake. We got to cut the carbs, the bread, the pasta, the bagels, the cereals. We got to cut those out. The tortillas, the enchiladas, all of these things we need to cut out. They are not helping with your weight loss journey. I'm not saying go full keto. You might want to do a modified keto or a healthy keto diet. But I'm saying if you want to lose weight, you're going to need to cut the carbs. Then nutritional deficiencies get people all the time when they're trying to lose weight. There are some nutritional deficiencies that are seen more in obese people than they are in people who are not obese or normal weight people. Things like magnesium, iron, zinc, vitamin D, vitamin B12. These are nutritional deficiencies that are not allowing you to lose weight. So we got to check these nutrients. Are you low in anything? Do you need a strong pharmaceutical grade multivitamin? Do you need to supplement vitamin D, zinc, or chromium? These are the things that you need to talk to with your integrative medicine doctor to help come up with a plan and a strategy to tackle your obesity, but also your nutrient deficiencies. So now we're going to talk about integrative solutions for weight loss. Things like Ozempic or semaglutide, Mounjaro or tirzepatide, phentermine, or there is naltrexone with bupropion. There are other things. Even metformin can be considered a weight loss drug. And I'm not going to lie to you. These are good medications. They're not bad medications, but they come with a catch. That catch is that you got to increase your protein intake by a lot, or you will lose muscle. You also got to get in the weight room and start weightlifting resistance training, or you will lose muscle. And as women, we do not want to lose any muscle. We do not want to lose any muscle. We want to be strong. We want our minds to be strong. We want our bodies to be strong. We want our muscles strong, and we want our bones strong. We want everything strong, okay? So we don't want to lose muscle on these medications. So we're going to need to increase our protein intake and start resistance training if you are taking any of those medications for weight loss. So if you need to lose 10 pounds, focus on fiber, protein, and good digestion. Digestion gets people every single time. Some people are not obese. Some people are bloated due to their diet. Things I look for as an integrated medicine doctor, and someone comes into me and they're trying to lose weight and they're also bloated and gassy and have abdominal distension and all of these things, I look for the bacteria H. pylori in their poop. That bacteria can cause abdominal gas, bloating. It can also stop you from absorbing nutrients like iron and vitamin B12. It can also cause cancer. So it's a triple whammy. So if you have H. pylori, we got to figure it out. We got to cure it and get to the bottom of it as soon as possible, because it can disturb your life in a number of ways. Another thing I look for is celiac disease or gluten intolerance. So gluten intolerance is when your body does not break down or absorb gluten at all. Gluten intolerance means you're going to have to stay away from wheat, bread, pasta, all of that, or get gluten-free substitutes. So I look for gluten-free intolerance or celiac disease. I look for celiac disease. I also look for food allergies. I look for food allergies. I look for food allergies when people cannot lose weight. Why? Because if you're ingesting foods that you're allergic to, it's not going to help you lose weight. I had a patient, she came in and she was trying to lose weight and she had abdominal pain, bloating, gas, distension, all of that. And we did a food allergy panel like I do on all my patients. And she was allergic to peanuts, she was allergic to wheat, and she was allergic to nuts. And she was eating a peanut butter and jelly sandwich every single day. And I was telling her, I was like, you got to stop that, because you're not helping yourself and you're not helping your symptoms. And once she stopped eating the peanut butter and jelly sandwich every single day, she got much better. She was much improved, and it was an easy fix. It didn't require any medications at all. So digestion is also key to weight loss. If you're not digesting, if you're not pooping out what you're intaking, you gotta look at what you're eating and seeing if you're allergic, see if there's bacteria, see if you're gluten intolerant, and things like that. My name is Dr. Elizabeth Kolawole. I'm double board certified in family and integrative medicine. These are my 2 cents on integrative solutions to weight loss. Thank you and have a wonderful day.